And now, Living Well with LDS Hospital.
All right, happy Memorial Day. It's that time of year where everyone's starting to get outside more often, and so we want to know, what do you do when you get a sunburn? So we've got Dr. Tawnya Bowles here with LDS Hospital to help us out.
Thanks for having me.
You and I both had one of those before, maybe more than one. How do you know when they're serious?
A lot of blistering on the skin or a lot of your body that's been sunburned. If you have any of those signs, you should probably see a doctor to be checked.
That's a good idea. So once you have the sunburn, right, I mean, how do you treat it? What's the first thing you should do?
If you've been sunburned, as you know, it hurts, your skin's dry, and you're usually dehydrated. So you need to drink fluids to rehydrate yourself. A cool bath can help with the pain of the sunburn, and then moisturize, especially with something that has aloe vera. It can be comforting to the skin.
I like one of the tips on the screen is drink extra water.
That's the first thing that stood out to me, too.
Right? Does it help flush the sunburn out?
It doesn't necessarily help flush it. It's going to take a certain number of days for your skin to heal. It is a burn to the skin, but you're dehydrated when it goes together with being sunburned. So you'll feel better if you hydrate.
Should we go back to the prevention part of getting a sunburn, like maybe you don't get it in the first place? Yes. When it comes to the rays, what's the difference between UVA and UVB?
Both are important for skin cancer. UVA rays tend to promote aging changes in the skin, and traditionally UVB was thought to be the radiation that caused sunburns and skin cancer. That is true, but we now know that both are important. We get both from the sun, we get both from tanning beds. So limiting that exposure is critical, and sunscreen can block both of those rays.
All right, so how much long-term damage do you do to your skin if you get one of these sunburns? Because every year I do the same thing. I go out and I'll burn that first time. We always talk about that. Get that first burn in, then after that you should be good and your skin will adapt. How wrong am I thinking?
It's very dangerous, especially for young people. So our kids should never be getting any sunburns, because we know that sunburns at an early age increase their risk of deadly skin cancers later. That has been shown in multiple studies. Now for adults, same thing. The onset of melanoma in most people is in their 60s. So if you're getting sunburn in your 20s and 30s and 40s, you're increasing your risk of melanoma later.
Will it show up later, like you're saying? Yes. So I would have gone, say, like today, and then 30 years from now, the skin cancer pops up.
Exactly. It's a delayed effect, so we need to act now. Parents, I see, are doing a great job with their kids, but a lot of adults still aren't doing a good job with their skin.
Well, Dr. Bowles, have you heard that too, talking about things you've heard as, you know, growing up, myths? All your sun damage is done by the age of 21. Is that true?
Not true, although the sun damage in youth is very dangerous. We know that skin has a memory for it later. But we live now into our 80s, 90s, and later. So we need to be protecting our skin throughout our life.
All right, so obviously covering up is one thing. We're talking about sunscreen is another thing. And then once you get it, fluids, everything else, what's the main thing we need to remember there?
Skin cancer can be prevented. That's the message I want everyone to hear who's listening. No one's immune to it. Some people are at higher risk than others if your skin is fair, but none of us are immune to it. It can be prevented. The vast majority of skin cancer can be prevented by sunscreen and protecting our skin.
And Utah has one of the highest rates in the entire country.
Yes, we're all at risk. So living in Utah puts you at risk. Once you see
a mole, once you have a pretty bad burn, how important is it to get in and have it seen by a doctor quickly?
Well, you know, for recommendations for checking the skin, whether you get a sunburn or not, all of us should probably be getting our skin checked once a year. If you live in Utah, you're higher risk. And so if you have something that's changing, whether you had a burn or not, you should be getting in sooner, within a month or so, to be checked for that lesion. Most skin cancer is found by patients. They notice it or their families notice it on them. So if anyone points something out on your skin or you notice something changing, that's a prompt to get it checked by a doctor.
I mean, you're not going to go to the doctor after you get one sunburn, are you?
No. Not necessarily. You know, if you have a lot of blistering on your skin, like we talked about, or you are feeling lousy or get a fever, you should see a doctor. But most people aren't going to see a doctor after their sunburn. But just keeping an eye on your skin and looking at the changing spots on your skin is important.
If you need more information, questions answered, LDS Hospital is such a great resource. LDShospital.org is their website. Also a phone number right there on your screen. Dr. Bowles, thank you so much. What a great day to talk about it. It's Memorial Day. Everybody outside in the sunshine, so cover up and protect yourself.
Thanks for having us.
We'll be right back.